Hello, everyone. I am happy to see everybody here. I'm Elizabeth Johnson. You've probably seen me somewhere on LinkedIn, Facebook, because I 1000% believe in the Healthcare Advocate Summit. So let me give you the actual backstory on how Melissa Page and I got together, how NAMAPA started, and how this equates to my definition, and really our definition as an organization of what an advocate is. Because let me tell you, without having a proper definition of what a healthcare advocate is, man, have I gotten some heat these last few years. So let me set the scene for you. It's January 2020, right? The world's still open. We're all still doing our thing. Melissa Page and I are on a plane. We had gone to do a speaking engagement. She comes from a hospital background. I've been in private practice my entire nursing career. And we're talking about, because as friends do on a plane afterwards going home, what's your 5-year plan? What's your dream? What's your vision? What do you want to do? I'm like, Melissa, we're on a plane. We're in first class and we just got drinks. We're going to have this conversation. So we have it. My dream was to have a nonprofit where I could educate, I could teach, I could share everything I learned the hard way with everyone so they don't have to do the same thing. Melissa turns to me and she goes, I have the same dream. Let's do it. Okay, we are clinical. She's a pharmacy tech, I'm a nurse. What do we know about nonprofits? Thankfully, there's Google and there's consultant groups that handle that kind of stuff for you. So we get together, we invite some of our closest friends in our little phone a friend network that we have. Kenny, Amber, Geraldine. And we start having these Thursday morning phone calls and changing our commute time to work during COVID, because we're all from home at this point, spending that hour talking about what the value of that nonprofit's going to be. What's its mission? What's it going to do? And all of a sudden it was like, we can't be therapeutic specific, because all of us are from a different therapy. It can't be restrictive. We can't say, because you're industry, or because you're a pharmacist, because you're a medical assistant. No, it was everyone, because everyone plays such a vital role from the time of script to the time it's administered, to the time that claim adjudicates. So NAMAPA was born. There's a really great video, it's not out there. One day we'll share it, of us all trying to figure out how to say it. But that's where it started. In our booth over there, there's this great timeline. It'll show you how fast we moved last year. And so on our website, if you look at it, there's actually 2 tracks. There's for patients, and there's for those in healthcare. And it brings you to these landing pages of who is an advocate? What is an advocate? And because I can't keep it memorized here, the definition of an advocate, right? A person who publicly supports or recommends a particular cause or policy. Pretty broad. So what's our cause? Our cause is healthcare. Again, that's really broad. Our cause in healthcare is access. We want those who work in this space, we want those on the receiving end to have access. There's a lot of pieces and parts to that. Publicly, I'm on a stage in front of all of you guys publicly saying, I'm an advocate. But there's so much more. Do you make it political? Do you make it per foundation or per group, per this? How do you do that on this public stage? Well, we're in the world of social media, so that's my first public. Here's what we're doing, here's how it's going. And what am I advocating for? Because I'm not a patient, right? And this is where we've had the issues with defining, and I want to make it abundantly clear today. Whether you are the patient or you are for the patient, you are a patient advocate. Because the minute something happens to you, and you may have been advocating for a patient your whole life, the minute something happens, you are now the patient advocate, and you are advocating for yourself. So if I use the term patient advocate interchangeably with healthcare advocate, it's one and the same. Because whether you're working for a physician, working for a facility, or you are that patient yourself, you are the advocate. And there's different types, right? Everybody's got a different job. There are the healthcare advocates that work in hospitals and clinics. There are independent or private patient advocates. There are advocacy groups or advocates within manufacturers. Again, What are we all doing? Titles are great. Going into that a little bit, I've been a biologics coordinator for most of my career. I'm an LPN, and I joke that I'm a low-paid nurse, not a real nurse. My nursing school teacher made that joke, so I took it. But that's kind of defined me, right? In different states, I can't do IV infusions. I have different scope of nursing. If I'm applying for a job and I'm not an RN, I'm very limited. So as an LPN, I'm very proud of my license. But what could I do to define who I am more? So as a biologics coordinator, my nursing's important. My clinical background is super important. But as a biologics coordinator, I'm connecting with others. They may be medical assistants, pharmacy techs, pharmacists. I have nurse practitioners and PAs who are also biologics coordinators. So that leveled the playing field. We're all in this together. But then I meet this group. There's financial navigators and so on. But sticking with biologics coordinator, I previously had worked for a large private practice group, okay? There's one biologics coordinator to 150 doctors. Pretty cool, right? It felt really important. But what can I do to get those to talk to me at the manufacturers? How can I get technology solutions and reps to come and talk to me? As a biologics coordinator, I'm not necessarily a decision maker. But you know what? I'm using whatever that product is. I'm fighting for that patient every day. So while I may not be able to sign that piece of paper at that time, I'm the one who's doing it. So advocating and using my voice was the most critical part of it. Flash forward. I now work for a wonderful company called Medico. I have a group of physicians who love and support me for my knowledge and what I've done. I have a great title. I'm CEO of Medico. And let me tell you how different it is to engage, sometimes with the same people I've worked with the last 10 years, and when I meet new faces, because I have a CEO title. It's completely changed advocacy for me. Different doors have opened. The same reps that I've worked with, it's like, well, now she can make decisions. And I love everyone I work with, but it's an amazing change to go through. But why couldn't I have had that as a biologics coordinator? Why couldn't I have had the same support and doors open when that happened? So I don't take for granted a single day where I am, the job I have, and what I'm doing. Because now, my advocate voice is louder. I'm able to connect with biologics coordinators. So upon taking my job with Medico, one of my requirements was, I want to be able to engage with biologics coordinators. Sure, I can help on the parts that I'm good at, but the doctors can't do their jobs without these people. So how can I support, encourage, and empower those? So I get to talk to biologics coordinators all the time, and I truly love it. I'm also creating a mini army of advocates, if you can't tell. So, same thing with you guys here. So taking those individuals, right, going back to this whole global theme of who's an advocate, those people are advocates, and I'm advocating for them. The labels, the terms, the who works where, I want to break that down. I don't want that to be a stigma. I don't want it to be a thing. I don't want, because you work this, or you work for yourself, or you work for a facility, you are a different type of advocate. Because when the going gets tough, when we don't understand something, because let me tell you, writing this advocate challenge we'll talk about in a little bit, I know my medications I work with on a daily basis well. I could write you a million different ways something could go wrong in my sleep. But going outside of my comfort zone, talking about access challenges with other infusion drugs and other specialties, I don't know it. I'm gonna point you out, Kenny, because I called you and said, hey, I need one more medication for this. What do I need to do? What can I use? And she's going through and she's talking to me about this medication and what are some of the pain points. I didn't know. I'm constantly learning. And so that's why I don't care what kind of advocate you are. I don't care what your title is. We're all advocating together. But when you need something or need someone, we're all in this together. That payer that you're on the phone with for 2 hours, I know by that point you're screaming mad, because Lord, I am. My husband, bless his heart, because I yell at insurance companies all day, so I'm really nice to him. So if anybody else has that, it's a great way to stay married. But taking that, and instead of being so mad and frustrated, I've been on hold, I've been transferred, I've been hung up on, hey, rep, whoever, you're part of the healthcare team. You're to help me advocate for this patient, so how can we work together to get this done? It's weird. They don't even think about it. They don't even realize that I'm asking them to advocate for this patient. So guess what, guys? They're a healthcare advocate too. Shocking, even though we sometimes want to scream. So the moral of the story, the short version of this is, no matter your title, no matter what side you are on, no matter who pays your paycheck or if you pay yourself, we're healthcare advocates, plain and simple. We are patient advocates, and we are, one day, or maybe now, are the patient that is advocating. So every time you look at something, every time you look at a different job role, who's doing what, whatever that is, keep that in the back of your head. We're advocates, plain and simple. I really want to bring focus to the advocates that kind of threw this event, right? Where it started, how it's going. 3 years ago, all of us had different jobs. All of us were completely different places in our lives. We've had weddings, we've had vacations together, we have had patients that have lost access to care, gained access to care. We've had patients that have passed away. There's a family friend of mine who unfortunately has breast cancer, and she has 2 young daughters. And I'm not in oncology. Melissa's in oncology, Kenny, Amber, Geraldine especially. And she sends a text message to me, hey, do you know anything about this drug? I can't get it. My oncologist has been trying for 2 months. Okay? I know nothing about this. I get on my phone, a friend network, I text. That patient, within 1 day, we made 1 phone call. It was overnight shipped, her oral medication to her the next day on a PAP program. She's been great. Her tumor markers are down, her last PET scan was clear. She texts, she messages, she puts on social media. She calls us her Earth Angels because we've given her an extra 2 years now with her daughters, right? That's the feel-good story. That's the, this is why I do it. This is why I advocate. But I also advocate on the other side of this for all those denials that I get. I don't have a 100% success rate. I don't think anybody in here does. There are some cases we just can't win. But what does that make me want to do? Man, it makes me want to go to the payers. It makes me want to go higher into legislation and things like that and push and say, hey, I want to advocate, plain and simple, but I want to push and I want to say, I know we're not going to win every time, but where is the line of practicing medicine, the art of medicine, and treating patients and policy? How does this all work together? And how do we meet somewhere in the middle? It's never going to be perfect. We are never going to be able to fix and have a perfect healthcare system because guess what? Everybody has a different opinion and way things should go. But how do we make it the best for our patients? My dream one day, 15 minutes on Capitol Hill, I want to explain what it's like to be a patient advocate. Kind of like I'm doing here. This is a great practice run. Thanks, guys. And I get longer than 15 minutes, even better. But I really want to be able to explain that role of advocacy and where that's going to go. I want to talk about how all these stakeholders are actually advocates themselves. So, with that being said, where do we go from here? What comes next? And I'm bringing it all back to NMAPA. Because if you look at the signs, if you look at the booth, it's about empowerment. It almost looks like recruitment, like we're bringing you in. And it's about, as Melissa said, having a seat at that table. I hope our tables are a little bit bigger. We need some more space. But I want people with that same passion. I want that, am I an advocate, am I not an advocate? I want that question to come to us. I want to be able to have that discussion, and I want to be able to ask why. Why don't you think you're an advocate? Or what makes you an advocate? Define it for me. Everybody's got their thing. So whether it's victories on the phone, whether it's getting your billing right every time you get it out, that's really, really important, all part of advocacy. NMAPA is a place where I have learned, I have grown, I've been able to represent something that is new. You only get one chance to be new. But it's allowed me to connect with other advocates, and it's allowed me a platform to, I learned something about Medicare yesterday. We talked about it. I went to Geraldine explained it. It's allowed me to have humility, right? I get to do these great talks. I get to work with manufacturers, And it's really cool. And again, don't take that for granted. But there's a lot I don't know. And so I love in the moment, I love when I'm doing something to be like, hey, let me call this out. This is brand new to me. Because everything's gonna change in a day. If you know anything about insurance, it's probably changed in the hour since I've been up here. But it's always changing, it's always new. I want NMAPA to be able to advocate for those that are learning. And I want humility to be a really big part of it, because we're not gonna know everything. And the whole point of this challenge we'll get to, medication access is medication access, right? You've got something and you need it. But maybe you don't know that disease state, maybe you don't know medical benefit versus pharmacy benefit. But that's the great part of it. This whole group gets together, there is no judgment, there is no what is going on. You're advocating for a patient and you need something. So let's talk about it, let's explain, let's dive into what that is. And then after we get it, right, because that's the priority, let's talk about all the steps you took to get there. NMAPA is a great resource. We've got many things on our website, but the one thing I want to get out there is definitions. Why in healthcare do we have 8 different terms for one single process? Is there no standardization? Can we advocate for that? That would be awesome. But within that comes confusion, right? A prior authorization is not the same thing as a predetermination. Though when we refer to anything that happens before treatment, it's prior auth, isn't it? Do you ever hear anyone say anything different? My favorite one I like to throw out is advanced benefit determination, or ABD. A lot of people don't know what that is. Your Blue Cross Federal does, that's what they do. So at NMAPA, trying to standardize, trying to talk about the same things so that we're clear into what is the part of the medication access process that you're actually doing. So we're starting our own terms. Pre-service review. There's benefits investigations, there's the authorization or the pre-D or whatever was required. Really, that's all one step. It's not 2 things, it's not separate. You should do both every single time. So we're trying to change that up, we're trying to get that message out. Because I think clear, concise messaging, healthcare's got a lot of staff turnover, we're a lot of staff shortages right now. Clear, concise messaging will go a really long way. The other thing about NMAPA that I think is just truly a beautiful experience for all of us is that it's almost the end of the year, guys. We're going into Q4. What happens in Q4? Anybody? Re-verification season, right? So re-verification season's coming up. And our manufacturer partners, right? They are truly our partners in all of this. They're gonna be coming knocking on your doors. And I know with COVID, things are different. We may not be having reps in our offices, so it's digital communication. But really open your eyes, ears, and hearts to your manufacturers during this time of the year. With NMAPA, we are here. If you don't know who your FRM is, if you want us to help connect, we'll facilitate that. We may not know them, right? We all live across the country. But how can I connect you? I've got my contact. They know who their counterparts are around. Let's connect. Let's get this done. With re-verification season, that's a lot to go through. A lot of policies will change. Patients will get new insurance. How do you navigate that? Start October 1st. I start by hanging up posters in an office. If your insurance is going to change, please let us know. Subtle, right? So the patients can start seeing. I change voicemail recordings. I change pre-recorded messages or text messages to patients. It gets a little old if they keep coming in, but it's getting that point across. Blue Cross Blue Shield of Texas. So we're in Texas, I'm gonna talk about them. Has probably one of the best educational handbooks for insurance of any of the payers I've seen. They have a great little diagram of what an insurance card looks like. I print that out and I hang it up and I highlight different numbers on that card. If any of these numbers change, come talk to me. If this logo changes, come talk to me. So we start that communication early. And so if you go to our NMAPA website, we've got a whole guide from last year, which we'll be updating, about re-verification in blizzard season. But by communicating that to you, and then you communicate it to your patients, and then patients talk to their friends, and so on and so forth, that's how we're going to help people. My daughter asked right before we came up here, and she's 13, so, you know, has lots of questions. She's like, what do you hope to get from this summit? Right, so she's seen the late nights, early mornings. Melissa loves Saturday phone calls for planning. And so I answer. There's some background TV or something, and I'm looking at her, and I'm like, there's 200 people coming. If I can teach at least one thing to every person, they're going to go back to their facilities, to their jobs, to their friends, and maybe they'll teach them something. So that's another 200 people. And then that multiplier just keeps going. That's incredible. That takes my advocacy heart and just makes it swell, because that's what I'm pushing out there. Mind you, she tuned me out and looked away, and I was like, are you kidding? This was profound, but I'll forgive her. So think about what you're going to learn over these next few days. And if you knew everything we're talking about, cool. Please come tell me that so I know what to do better next year as the education director for the event. But think about that. Think about what's one thing you can go back to your practices about, you can advocate for. Hey, we need to do this. Hey, I think this is a really great idea. And we can really push that and get that out there. That's more patients that you can help. The other thing that I would challenge you to do, right? And I'm going to challenge y'all a lot today, and you're going to see a lot of me with this advocate challenge coming. But one thing I would like to challenge you to do is to take a look at where you are, whether it's your facility, whether you're in private practice, whether you're in pharmaceutical company. There's always something that can be changed to work more efficiently or to do better. Advocacy is one of those things. It's a buzzword right now. Everybody's getting some sort of advocacy thing going, but what can you really do to define what that advocacy is for your organization? I'm coming up here and I'm saying, this is what a healthcare advocate is, this is what a patient advocate is, we're all one. But what can that advocacy or advocate be for your organization? For NMAPA, it's us, it's you, it's everyone in this audience. But what is it for your job? What is it for your role? What can make you more efficient, or what could make you a better advocate in that role? There'll be other presentations we do over the next 2 days talking about how to get your executives or others in your organization to listen at the value and importance of things like this. But if you are up there, if you are a decision maker, what can you do from the top down to implement advocacy? Reward, support, empower, and get those who work with your patients out there and doing more work with those patients without being burnt out, tired, and frustrated. And again, I know healthcare's tough right now. But when the patients feel that toughness, when the patients don't feel like they are supported or understood, that's going to work its way back, and that's going to be a bigger problem. So I challenge everyone to look at their organizations and really think about what you can do. For me personally, at my job, I push my physicians, sorry, Dr. Diaz, I push my physicians on documentation, because little changes like that allow the biologics coordinators to be more efficient at their jobs. That's how I advocate for them. So I give out handouts, cheat sheets, talk about it, whatever it is. But that gives them with the tools they need to help to do their job. The biologics coordinators and so on can do theirs. So a little bit of a ripple effect there. And I'll keep pushing, even though they may not be fans of it.